This summer, Medicaid, America's largest public health program for low-income families, is facing what may be its most serious political reckoning in over a decade. Behind the closed doors of Congress and across the airwaves, a quiet war is being waged over who gets care, who foots the bill, and what kind of country we want to be. At the heart of the issue is the 2025 Budget Reconciliation Bill, pushed forward by the Republican-led House and now the Senate. If passed as proposed, it would reshape Medicaid as we know it, potentially cutting as much as $880 billion over the next 10 years. The motive? Fund a slate of tax cuts and military spending priorities without bipartisan support. Let's break it down. Lawmakers are considering placing hard caps on federal Medicaid spending, either by setting per capita limits or block grants to states. Translation: fewer federal dollars, more financial pressure on already strapped state budgets. At the same time, federal incentives for states to expand Medicaid under the Affordable Care Act would disappear, potentially leading many to roll back coverage. The proposal also includes stricter eligibility requirements, including work mandates and increased paperwork. History tells us that even minor administrative hurdles can push millions off the rolls, not because they no longer qualify, but because the red tape is too thick to navigate. Estimates vary, but the Congressional Budget Office believes at least 13.7 million people could lose coverage under the House version. Some health economists warn that figure may climb north of 20 million if states pull out of Medicaid expansion altogether. The people hit hardest? Children, people with disabilities, the elderly in long-term care, many of whom cannot work and have no other path to health coverage. Rural hospitals already on thin margins could shutter. Prescription access would dry up. Emergency room visits would spike. And for some, especially those managing chronic illness, the result could be fatal. Over in the Senate, amendments are being hashed out behind the scenes. One floated by Senator Rick Scott would lower the federal match rate for Medicaid expansion from 90% to a variable state-based formula by 2031, saving an estimated $313 billion, but almost certainly prompting some states to scale back their programs. Word is, Senate Republicans are eyeing even deeper cuts than the House, an effort to pay for corporate tax breaks and ease the national debt. But that math only works if you overlook the human cost. The opposition is vocal. Advocacy groups, hospital systems, and public health experts have issued urgent warnings. Protesters have taken to state capitals. Even moderate Republicans are voicing concern behind closed doors. Social media, too, is ablaze. Posts from public figures and activists spotlight the contradiction between the administration's promises to protect working-class Americans and proposals that could undermine their access to care. Senator Elizabeth Warren has called on citizens to flood Senate offices with phone calls, demanding the cuts be blocked. Though much of the noise is coming from Congress, the White House is also preparing to reshape Medicaid through executive action. That means unwinding Biden-era waivers that aim to address social needs like housing and food insecurity, stabilize coverage for children, and support incarcerated individuals re-entering society. Instead, we may see a return to program integrity efforts, code for tougher eligibility checks, re-verification systems, and a renewed focus on fraud prevention. Critics say this approach often weeds out the needy along with the ineligible. States are bracing. Many are already staring down budget shortfalls thanks to slower revenue growth and inflation. If Washington slashes Medicaid, governors may be forced to choose between cutting health coverage, raising taxes, or slashing education and infrastructure budgets. Some states, like Idaho and West Virginia, are preparing to implement more frequent eligibility checks, steps that may further erode coverage and possibly clash with federal rules, setting up potential legal fights. A surprising wrinkle in all this? Many Americans don't even realize they're on Medicaid. Thanks to rebranding efforts by private insurers, some beneficiaries think they have standard insurance plans. That's a problem for advocates trying to mobilize opposition. If people don't know they're affected, they won't fight back. But the stakes are clear. Medicaid saves lives. Research shows it increases access to life-saving drugs, reduces preventable deaths, and stabilizes families during crisis. Rolling back coverage at this scale risks reversing 2 decades of public health gains. As of June 30th, 2025, we're in the thick of negotiations. What comes out of the reconciliation process is still uncertain, but what is certain is this: Medicaid is no longer a quiet pillar of the American safety net. It's a political battleground, and depending on what Congress does next, tens of millions could find themselves without a lifeline.